Hello everyone, this is Team CureCrafters and we are here to introduce about our solution to combat the global severity of diabetes, focusing on Malaysia. Let's look at the current situation of diabetes in Malaysia. Malaysia, known as the fattest nation in Southeast Asia, has the highest incidence of diabetes in the region with 15% of population affected. Type 2 diabetes is increasingly prevalent among children, which parallels with rising childhood obesity rates. UNICEF reports that 12.7% of Malaysian children aged 5 to 19 are obese, and 7.1% of children under 5 are overweight. In 2017, diabetes and obesity-related healthcare costs totaled $1.7 billion, excluding productivity losses from absenteeism and medical leave. Hence, addressing diabetes is crucial for not only improving public health but also reducing economic burdens. The causes of diabetes in Malaysia include family genetics, sedentary lifestyle, smoking, and unbalanced diet. The main issue is an unbalanced diet with increased fast food and high sugar product consumption. Popular high-sugar foods in Malaysia include teh tarik, cendol, and kuih muih. Additionally, many imported biscuits and cakes are high in saturated and trans fats, using sorbitol or fructose as sweeteners. Several indirect factors contribute to the rise of unhealthy food consumption in Malaysia. Firstly, economic development has led to longer working hours and less leisure time, making fast food a convenient option. Secondly, aggressive marketing of processed foods on social media and advertisements has increased the demand for sweets, fats, and sugar, shifting diets from traditional to ultra-processed foods. Companies are aware that no matter how nutritional and healthy the food is, if they are not tasty, there will be less customers attracted to those. Lastly, food globalization has resulted in an influx of fast food restaurants and imported sweets. Now, how can we solve this problem?
A major difficulty faced in treating patients with diabetes is continuous adherence to treatments. As a chronic condition, in addition to oral medication, monitoring of glucose intake, and lifestyle changes, diabetes requires consistent monitoring to ensure effective treatment. However, continuous glucose monitoring in hospitals can be costly and inconvenient. Thus, alternative methods to monitor patient adherence to treatments must be considered. Our solution is a smart toilet designed to act as a passive monitoring system with minimal human intervention. Using the technology outlined in a 2020 paper from Stanford Medicine as a guide, we developed our own model of a smart toilet, one that is used to detect glucose levels in urine to determine the effectiveness of diabetes medication. Our biggest objective is convenience. Due to the interference that long-term in-hospital treatment of diabetes would have on the daily lives of patients, it is necessary to develop alternative methods of care that can be implemented in the home. This is where the smart toilet seat comes into play. Using the existing model of a typical toilet, a user presses a small button attached to the lid, indicating whether or not they would like urinalysis to begin. After excreting waste, a robot arm dips the urine test strip until the whole paper is wet, then drops the strip down the toilet. A camera attached to the underside of the toilet analyzes the colors shown on the strip and estimates glucose, ketone, and protein concentrations in the urine. The collected data is then uploaded to a linked national registry, which we will explain in detail later. Due to the variability possible in results due to various lifestyle decisions, a health alert will not be sent to the patient or to medical personnel unless abnormalities are detected 3 times within a 1-month span. After analysis is complete, the machine automatically uploads the relevant data onto an online network, updating the patient's personal medical history if connected. The only thing the patient has to do is scan the QR code for user identification and press the button to begin urinalysis. This leads to the second part of our solution, which is the creation of an online nationalized diabetes registry. This would centralize all patient records and identify patterns of interest across patient data. Real-time updates, such as those provided by the smart toilet, would also serve to alert patients and medical staff in the event of any abnormalities. Based on existing diabetes registries in Singapore, the United States, and Sweden, we propose a model that draws upon current databases to collect information such as patient history, medication records, and other electronic health records in order to create a more comprehensive examination of the variables that influence a patient's health and lifestyle. Each patient is assigned a specific identifier upon entry into the system. This identifier, such as an NRIC number or other National Health Service number, is used to track the patient's data across multiple registries or health records. Manual entry is also possible. Variables recorded could include duration of treatment, process of care, types of treatment administered, and current patient status. The database could also be linked to a mobile application, which could send alerts or reminders to the patient as necessary, or in the case of any abnormalities, alert medical officials by adding an icon to the patient's electronic file or pinging the medical officials.
We will now explain the 8 benefits of smart toilet installation and its differentiation from the blood test and the glucose blood meter, which is an already existing medical technology used for measuring the level of glucose in blood. The first benefit is that the glucose level in urine can be checked every time the patient uses the bathroom, providing instant health updates, whereas a blood test takes longer and requires financial resources from the individual. And moreover, currently existing blood glucose meter requires individuals to remember to bring it along, whereas using the smart toilet a few times a day will naturally inform them. The second benefit is that it is useful for patients who do not have the time and financial availability to actually go to the hospital for a blood test or buy technology-based options such as the existing blood glucose meter right now. Our third benefit would be the instant updates that are provided by the National Diabetes Registry through the implementation of the smart toilet. The transfer of database from the smart toilet is much quicker and efficient than updating the results of the individual's blood test. The fourth benefit would be that the toilet maintenance is considerably easy as normal toilet cleaning methods will be used. Our fifth benefit would be that because taking the glucose level in urine is an indirect method compared to the blood test, it is way less invasive and less painful to the patients. The next benefit is the transfer of data tracking and analysis in the QR code that's provided for users to view, and it's linked to the hospital database. This facilitates communication between patients and healthcare providers for personalized care management. The seventh benefit is that the healthcare providers can access the patient's glucose data, provide timely advice or interventions without the need for in-person visits. This is useful as medical checkup from a blood test is only for a one-time visit, whereas the integration of database from the smart toilet and the hospital will ensure constant communication. And the final benefit, the public awareness. As installed in the public bathrooms, the public as a whole will learn to be more aware of diabetes, influencing the change of their diet and lifestyle to something potentially more healthy.
The initial distribution of the smart toilet will be to the government hospitals within Malaysia, starting from the Hospital Kuala Lumpur, which is the biggest hospital in Malaysia. The installation of a new toilet system will assist in quicker diagnosis and monitoring of patients with diabetes. The collected data will also be sent to the National Health Registry, where a nationwide statistical analysis of diabetes can take place. As for the final step of this project, a public-private partnership between the Malaysian government and private medical technology company can be established. The smart toilet will be manufactured by highly skilled engineers from the private medical technology company and distributed at affordable price to the public by the help of government grants.
To ensure the longevity and success of our smart toilet program, we have a sustainability plan. First, we'll establish a maintenance plan with periodic checks to ensure all components work correctly. Second, we'll seek partnership with MedTech and medical device sponsors to secure ongoing funding, especially for low-income families. Third, we'll implement community outreach programs to educate the public about the benefits of the smart toilets and encourage adoption. Lastly, we'll emphasize the long-term health benefits, turning education initiatives to motivate individuals and communities to integrate this technology into their daily lives. To overcome barriers to our technological solution, we have key strategies. First, we'll address the lack of awareness by conducting targeted educational campaigns. This will raise awareness about the smart toilet's benefit and ease of use, addressing misconception in simple, relatable terms. Second, we'll overcome resistance or skepticism by engaging community leaders and healthcare professionals. Their endorsements and success stories will build trust and credibility, encouraging adoption among hesitant populations. Third, we'll tackle the difficulty in navigating the technology by providing accessible support channels like helplines and community workshops. This will offer step-by-step guidance and immediate assistance, ensuring users feel confident and supported.